Hello, and welcome to the webinar. I'm Victoria Rashke, Director of Technical Assistance and Training for the Council, and I will be acting as moderator for today's webinar, Self-Care Basics in the HCH Setting, a production of the National Healthcare for the Homeless Council with a grant by the Health Resources and Services Administration Bureau of Primary Health Care. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Health Resources and Services Administration. This session is being recorded. This is a 1-hour presentation with the last 10 minutes reserved for Q&A. Underneath the presentation slide, there is a chat box for participant questions and technical issues. Please type your questions or technical issues into the chat box at any time during the presentation. A selected number of questions will be answered at the end of the presentation during the Q&A session. The PowerPoint presentation and the recording of this webinar will be posted on our website, nhchc.org, within 3 business days. Today's presenter is Nicholas Apostoleris, a psychologist who serves as the Health Center Director for Action Health Services, a healthcare for the homeless and public housing primary care center operated by Community Health Connections. He is the VP of Behavioral Health Services for Community Health Connections and manages a service of psychologists, psychiatrists, social workers, community health workers, nurses, counselors, and support staff. He is also the Director of Behavioral Health Science for the Fitchburg Family Medicine Residency Program, which trains physicians who want to become family physicians. And he has a clinical practice at the health center where he sees patients experience a variety of life problems, including homelessness. I'd like to turn it over now to Nicholas.
Well, thank you, Victoria, and thank you for everybody for choosing to listen in. Here are the objectives for this webinar. I'm hoping that you all will understand what's meant by the terms self-care, vicarious traumatization, and compassion fatigue, that you'll understand signs that more effective self-care is needed, understand what an individual can do better to better their own self-care, and understand what an organization can do to promote self-care in its employees. There's a theoretical framework that I've studied and I find useful called self-determination theory. It's out of the University of Rochester, and its homepage is at selfdetermination.org. You might want to take a look at that page to get a feel for where I'm coming from. And coming out of that theory, it posits 3 fundamental psychological needs: autonomy, competence, and relatedness. And I'm suggesting that you keep those 3 concepts in the back of your mind as we go through this webinar. Autonomy, consider that to be perceived choicefulness. Competence is perceived competence. How well does the individual think he or she is doing in managing the tasks? And relatedness is meant perceived relatedness both to self and to others. So keep those 3 in mind, because it's assumed in the theory that when those 3 psychological needs are met, autonomy, competence, and relatedness, we all do better. So what do I mean by self-care? I'm talking about the caregiver caring for himself or herself in an emotional, spiritual, physical sense so as to strengthen and make him or her more resilient and healthy. What I don't mean is self-care with the ultimate end of improved productivity. One definition I found helpful in the literature of self-care encompassed self-awareness, self-regulation, and finding balance. I thought I'd spend a little more time on these concepts right now. So self-awareness. We all come to our work with histories, our lives that we've led, areas where we're sensitive, and also areas where we know how to handle things. We've been through things and have found coping strategies or ways to navigate that have been successful for us. so that even objectively, if people say, wow, that's a tough situation, we know we're pretty much okay there. But there are areas about the sensitivity. We all have had circumstances in our lives where things didn't go well and where we may be vulnerable. So being aware of our vulnerabilities is critical to self-care. And where we find these vulnerabilities, there is a particular need for support, consultation, or supervision. Now my hope, I don't have all that many slides, so my hope is that we'll have an active question and answer session at the end there. Because this format right now, you can't really easily ask questions in real time. So write them down, and I hope we have an active Q&A session at the end. Self-regulation. Well, you can be self-aware, but self-awareness alone doesn't do it in terms of self-care. The self-awareness part is the assessment. It's figuring things out. Self-regulation could be seen as determining a plan to address the needs found in the self-awareness assessment and then taking action to carry out that plan. Self-regulation. And this is a very broad definition of self-regulation, but I think it's useful in this context. Finding balance. On the surface, that's easy. On the surface, it's also ambiguous. So when I'm talking about finding balance, I'm talking about determining what I'm calling major fault lines are in your life and in your current adaptation to life, finding the direction of the stresses pulling along those fault lines, and then finding the balance that works best in your life. So that is a very individual process. We're not looking at elimination of stress or elimination of tension. Tension almost here as a mechanical analogy. And it's not necessary to eliminate stress and tension. And in many people's lives, a little stress or well-managed stress can be the drivers for innovation, change, serendipity. There's a lot that can come out of stress and tension that you don't want to eliminate. But I brought up the idea of a fault line. Fault lines imply the potential for destructiveness. And where stress and tension in your life has the potential to be destructive, think about those tensions as lying along a fault line. And a goal would be to find where those fault lines are and get a sense of how dangerous they are for you. Some things are a little bit dangerous, some things are very deep and potentially hurtful, and you want to have a good working inventory of where your vulnerabilities are, and always remembering that it's assumed that the vulnerabilities are there. Some folks give a good impersonation of Superwoman or Superman, but really that's just an impersonation. I think there's widespread assumption that everybody has their areas that they need particular help and support in. Without stress, some people look to replace their life with some stress. They find life with perceived low stress as being boring or unfulfilling. But that could also be something of a protective device to say, well, if I'm not really stressed out, I'm bored and look for things to do. We have to distinguish between normal, manageable stress and poorly managed chronic stress, which is a clear health and well-being hazard. So if there's some determination to make or some assessment to make, the key task is finding out which of the stresses are manageable and which of the stresses are not so easily manageable and need some particular attention. that requires self-awareness, and it also requires using people who know you well to be mirrors or to reflect the manifestations of poorly managed or overwhelming stress. You know, the idea of overwhelming stress is important to address here too, because there are times when no matter how good our coping mechanisms or how many different self-care techniques we use, the sheer mass or volume or intensity of stressors is overwhelming our coping mechanisms. And that's something that needs to be assessed properly, so that really the volume of stressors or the intensity of stressors needs to lessen. It's not a matter of coping with that. It's a matter of lessening the application of stress. Professionals have some tools, both in terms of interview techniques, but also some evaluative tools to assess stress in a more valid and reliable way. So professionals, depending on whom you access, may be looking to do a full inventory or a formal assessment of the stressors and how you're coping with those stressors. In the work that we do in HCH, there are some stresses that seem to pop up pretty regularly and that they're understandable considering the context that we work in. And I'd like to talk a little bit about those because I think, and I'd also like to encourage questions and comments about these and see if I'm on target regarding these CHC relevant stressors. The first category I have is boundary-related stresses, and that's when we help to the point of going too far and not attending to the boundaries that keep us safe. Those boundaries can be keeping us safe physically as well as emotionally and spiritually. Another type of boundary-related stress that maybe doesn't get talked about so much is when people are asked to maybe go beyond their comfort level or even beyond their level of competence because the situation demands it. So if there are not good alternatives for the patient or the client, we may feel compelled to go too far in terms of what we offer, even if it's beyond our level of competence. So as I'm saying that, I'm reminded of two of the fundamental psychological needs. The first is autonomy or perceived choicefulness. Okay, so if we feel compelled in any setting, our level of autonomy, perceived autonomy, is very low at that point. Perceived competence, when we're doing things and we know how to do it, and we're doing it in a way that we know how and we feel confident, our perceived level of competence is high. Well, if we're being asked to go beyond what we feel we're competent to do, then we're going to also get hit on our perceived competence for our psychological need. The next category, empathy-related stresses. So what do we do in HCH settings? And this applies broadly. It doesn't just apply to clinicians, certainly. It can apply to front desk staff, certainly CHWs, community health workers. It can apply to interpreters, that we provide empathetic listening. So there's some stress or tension between the provision of empathetic listening or empathy in general against protecting oneself against harm, against the vicarious traumatization. We'll talk a little bit about that later, against being traumatized by being too directly exposed to someone else's trauma. So the stress or the tension there is between connecting, which is what we want to do, what we're trained to do, and what we get into the work to do, connecting, versus protecting oneself. Another empathy-related stress can be when we do empathize with a client, and then as we learn more, or even we know it up front, we're empathizing with someone who's committed things that we have real serious problems with. And we may also be empathizing with other individuals who may be victimized, and that can cause many providers and workers stress. Then I'm calling the next category frustration-related stresses. And that's when there's just an overwhelming number of problems, or the problems are just so severe that they're not easily or readily dealt with. Too much coming on in too many different domains, not enough time, overwhelmed. And I hear that from all sorts of workers in all sorts of line of work in our HCH program, including physicians, trainee physicians, mental health clinicians, that, oh my gosh, there's an awful lot, and I can't do everything I want to do. And then related to that is that sometimes progress needs to be looked for. Sometimes it's obvious, and sometimes it's dramatic, and those instances can be incredibly nourishing, but sometimes progress is hard to find in our clients, our patients, and that can produce frustration also. Then, of course, there are systems-related inefficiencies or impediments, meaning I just couldn't get that information. I should have been able to get that information. It should have been on my laptop in the field. It didn't get there. I need it to do this work. I'm just frustrated. I don't know why it didn't happen. And that can be a stress that expectation versus reality can create a stress there. One little framing again. Those empathy-related stresses, those pertain very directly to relatedness as one of the 3 psychological needs. Okay, so what's the issue regarding self-care? If self-care isn't there or if it's insufficient, there is evidence now that it is directly associated with burnout. So burnout is exhaustion, depersonalization towards clients, not seeing the accomplishments, and it is a major cause of people leaving the field prematurely, absenteeism, low job satisfaction, low life satisfaction. So burnout is a very serious problem. The literature is deepest in the field of nursing, where it's been recognized as an occupational hazard now for a few dozens of years. Work-related manifestations of burnout include diving in. So diving in, just got to get it done. Don't talk to me. I'm working late tonight and I'll be in early tomorrow. Yeah, I know, but I got to get this done. Vacation, well, I'm sure it'll accrue. I'm not going to take a vacation this year. Alternately, giving up on the work. Just going through the motions, punching the clock and checking out emotionally. And then another sort of related but possibly less problematic response is slowing down, possibly not getting as much done, but staying engaged. If the slowdown is too noticeable or too extreme, it becomes a work-related problem. And the slowing down or the giving up, that can happen within a few days or weeks. Compassion fatigue is seen as something that can come on quickly. A sense of, I can't handle this. It's not good for me to handle this. I'm exhausted. My work is draining me. I just can't connect, or I don't want to connect with my clients. I hear comments like that. These are from people in the field who are clearly compassionate people, who have a history of being compassionate to others, doing really hard work, great work, but those feelings of compassion have been replaced with depressed feelings about the work, about how the work can be helpful. They're replaced with physical symptoms. And sometimes people continue to do the work, and it's hard to find outward signs of compassion fatigue. But when you talk to people in a more genuine way, they're not intrinsically motivated to do the work. Intrinsic motivation is another concept coming out of self-determination theory. And it's really, intrinsic motivation is about when you do something for the love of it, you get lost in it, you do it, you would do it if you weren't getting paid for it. It's what you do. It's what you want to do. And some people come into the work with a high level of intrinsic motivation, and then it might get lost. And other motivational sets take hold, including external motivation, like you're getting motivated purely for the money, or some other types of internal motivation, but not intrinsic motivation, like I'd feel guilty if I didn't do it. So that's not the same. I'll do it because I don't want to feel guilty for not doing it is very different from I'm doing this because this is what I'm about. I really endorse the work. I feel good doing the work, and this is what I do for my work. Those are different approaches. And sometimes intrinsic motivation can take a really big hit when we get overloaded in our work. When the work is hard, effortful, everything is really hard. Analogous to when people are depressed, it's really effortful to get out of bed, and the day is without emotional reward. Well, if those sort of depressive symptoms focus on the work, then you might want to be looking at this sort of maybe exogenous cause or outside cause of these depressive symptoms related to burnout and compassion fatigue. So what does it feel like? Experiences of burnout, fatigue. That's the big one. Just so tired. Just not having the energy to face the challenges. Insomnia is a word that I'd like to broaden out to all sorts of sleep disturbances. It could be nightmares. It could be difficulty getting back to sleep. It could be fear of sleep, as well as not enough sleep. GI problems are a very common way that stresses are manifest through the body, and it comes out in terms of pain. It can be elimination problems, it can be digestion problems, but the GI tract is very sensitive to stresses that aren't well managed. Then there are the attitudinal and psychological experiences of burnout, which include, and this can be really painful for everybody concerned, is when there are negative feelings developed towards clients, more so than at baseline. I mean, once in a while having a client that really ticks you off or gets you annoyed, that's one thing, but having overarching negativity towards clients is very problematic and requires the self-assessment or an external assessment to make sure that that's what you should be doing in terms of the work. Alienation from social supports. So if someone is really well connected in their life and at work, and then they just don't feel like there's anything there anymore, or they withdraw from the social supports that they had, that is an experience of burnout as well. Frustration is tied in with the fatigue in that the frustration makes everything harder, and with fatigue, there's less energy to do anything. So combining fatigue and frustration makes for a descending spiral. Feeling unappreciated is in a lot of the literature as an experience of burnout, and that's something that can be caught, that the individual can catch that, him or herself, and really assess it. Is this a cognitive distortion, as I say? Is this a distortion of what I'm actually experiencing, or am I really in an environment in which I am unappreciated? So that's something to check in for yourself and maybe check in with others who share the same environment with you to see, is it just an unnurturing environment, or are you not at that moment able to feel appreciated? And that's somewhat different. So feeling that accomplishments are just not there is, again, sometimes it's reality-based and sometimes it's a distortion. So being able to have that social support, that network, peer supervision, for example, is the best way that I've found for clinicians to address these issues. Is a peer supervision group will, first of all, be open. It's non-evaluative, and it allows for people to say, hey, look, I'm not doing so well here. I'm not feeling appreciated. Others could say, yeah, I hear you. I've got the same problem. Or, well, how about this or how about that? So certainly for mental health clinicians, I've found peer supervision groups to be just the most valuable thing for keeping people safe from burnout. Feeling overwhelmed. Now, again, feeling overwhelmed, there are times when just about anybody would feel overwhelmed. And then there are times when the same individual, had the same stress load 6 months ago and didn't feel overwhelmed, but now does feel overwhelmed. So proper assessment of whether this is psychologically loading more prominently, or is this an environment that is truly an overwhelming environment, so that we don't pathologize people when they have a normal response to an unhealthy environment. Another experience of burnout that is unfortunately common is coping inappropriately through use of substances, alcohol or illegal substances. Now, in our settings, in HCH settings, there's just, at least the setting that I'm in, the client population has just an overwhelming breadth and depth of trauma history. So you're not dealing with worried well clients. You're dealing with people who have been through too much in their lives and often are experiencing ongoing traumatization. And one thing that can be hard for care providers is that you might not always be braced for when someone reveals their trauma experiences. So you might be caught off guard and vulnerable yourself. And it's worth doing some self-care work to prepare for getting blindsided by information that can be really harmful. So let's say that we have full-time jobs in an HCH, and a lot of our work is with the client population that is highly traumatized. Well, even though intellectually we might be able to say, well, this is a really hurting group of people that I'm working with professionally, experientially, still a lot of our time during the day is with people who are very hurt. And that can shift our expectations of what people are up to, what people are out there. What's normal life like? What can I expect if I open myself up to my neighbor? What's the world like? When we work in a setting that has so much pain, we're at risk for having our expectations shifted in terms of what other aspects of the community might be experiencing. So vicarious traumatization, along with compassion fatigue, vicarious traumatization is a relatively new term. I think about 20 years old, 18 years old. And as a supervisor of mental health clinicians, this is a key concern of mine, trying to protect or help staff protect themselves from being traumatized vicariously is really a key role for a clinical supervisor. And in our setting, it's been a prominent role, or even a primary role for me in a clinical leadership role and also administratively. So for vicarious traumatization, there's an assumption that the person is, or the caregiver is being harmed by the exposure to the shared experiences of the traumatized individual. So that the use of the term traumatization is that the caregiver is being traumatized through that connection, that empathetic connection with the person who has been the receiver of the primary trauma. And vicarious traumatization in the literature is considered to have a long-term effect on cognitions and beliefs about others, about the world. Now, for those mental health folks out there, it's not like countertransference in which there's no assumption of trauma for the caregiver, and that here in vicarious traumatization, the source or the root of the negative change is the external traumatizing event. It's not within the relationship between the caregiver and the client. It's between the client and whatever trauma the client experienced. The other thing is that for vicarious traumatization, the negative effects of being traumatized get generalized beyond the particular relationship that the caregiver experienced as traumatizing. So this is, to me, obviously very serious. And the question then is, what do we do about this? And I'd like to just break that into two domains, if you will. One is the personal response, and then the other is an institutional or contextual response in terms of the workplace. Self-care to protect and nurture values and vulnerabilities is what I came up with this slide. So remember, we're talking about self-assessment, and that self-care requires us, as having done that assessment, that self-awareness. And part of that self-awareness or assessment, I think, should break it down right to radical causes here, right to the root of things. What does this individual value? What are the major stress vulnerabilities, the fault lines we were talking about before, I was talking about? How does the work that I do play into or involve these values and fault lines? Even, is my work something I want to continue doing? Or do I need to, yes, I want to keep doing it as is, or do I want to change it or transform it into something that might have a higher level of intrinsic motivation for me, considering what I value, who I am? So getting the self-assessment or self-awareness down to a pretty clear look in the mirror about what you're about and what your vulnerabilities are and whether the work is a good fit. Here I'm going to talk about some what I call individualized approaches to self-care that draw on the self-assessment. Again, these are going to be very different in terms of how they play out, one care provider to another. These are not the sort of standard things. These are what you would want to tailor to your own life, your own experiences. And the first step here is to do some serious reflection, and sometimes this is hard to do, but trying to remember what has been rejuvenating, what has been healing in your life experience, something that you can access at least mentally and possibly physically. But what has been rejuvenating, what has gotten you going again in the past? And it might be something unrelated to what your expectations of self-care might be. And I'd be interested in I wish I could talk to all of you and figure out or hear from you what experiences have been refreshing and healing for you that might be just specific to you. So don't worry if it seems unusual. As long as it's pro-social, as long as it's not harmful to yourself or will land you in jail, then think about doing it. Pursuing your own sense of who you are, your own genuine self, and consciously pushing back against what you think is going to be highly regarded by others or by your sense of should. That again draws right on self-determination theory, where there's a distinction made between what's intrinsically motivating, again, and what's being done for other reasons. There are a lot of good reasons for doing things that aren't intrinsic, like I need to have a good job to take care of my family, and I'm fine with this job. Yeah, it's work, but I do it. That's fine. In that scheme of things, that's internal motivation without introjects. Don't worry about the details on this. But something that makes you feel guilty or makes you feel like you'd be a bad person if you didn't do it, that's a different flavor. And that's where you want to be very clear about whether you're affirmatively wanting to do something because you want to do it, or whether you are doing something because you don't want to feel bad, guilty, shamed for not doing it. When I work with people who are in the helping professions, it's a very different, I don't know any of you, but it's a very different group generally, in my experience, from, say, working with offenders, people who have been incarcerated multiple times. So in general, people in the helping professions might have overdeveloped senses of responsibility to others or to the community, and might need to be prompted to take care of themselves in their own ways. And I put that in parentheses, not including working harder in the care of others, because that can feed right back into a burnout cycle. So it also, I talk about not including working harder in the care of others, because part of this is valuing one's own self enough to take care of one's own self. So having that value be really deeply believed, truly believed, that who you really are is valuable and worth taking care of. Now there are generalized approaches, including a building body of literature regarding what are overall approaches to self-care that have been shown through the evidence to be protective. And I'll go through this. This was the Harrison and Westwood article. This gave a nice set of bullets. Countering isolation, we'll talk a little bit about that later. Developing self-awareness, we've talked about that. Expanding perspectives to embrace complexity. Moving away from black and white thinking, moving away from yes-no thinking. Understanding that instead of yes but, there are a lot of situations where a yes and response might be more helpful, that there are different levels of complexity that require different types of analysis. That can allow for managing the ambiguity, the uncertainty, better than if you're requiring a yes, no, right, wrong answer to a question quickly. It can be, this sort of work can be really, really hard in a black and white frame. So embracing complexity, I think, is very worthwhile to look into more. Active optimism is different from Pollyanna, the world's a wonderful place. Understanding the potential for change and how difficult change is, both in ourselves and in our clients and the people we work with, makes for appreciation of change when it happens, to be really something to celebrate instead of an expectation. Well, why didn't I change? Well, it's kind of hard to change. So let's celebrate when there is positive change. Self-care here using a holistic view of self-care, meaning let's not focus narrowly on the physical self or exclusively on our cognitions or on our sense of wonder or spirituality. Let's try to have a holistic approach to self-care. Maintaining boundaries and respecting limits, I touched on that earlier. In our setting, I think this is critically important, and that's its own talk about maintaining boundaries and respecting limits, but it's really hard and very valuable to dive into it. Embracing empathy, there's been some work lately on people who have this exquisite sense of empathy in which they really have this, I call it a broadband connection to others, their clients, and yet they seem not to be at risk for the sort of vicarious traumatization that many of us experience. And that's an ongoing field of study regarding how about these folks that can do this broadband communication with people and are okay with it. So we're learning more about that, and that again is an advanced topic that is very interesting and interesting to me personally. The experience of professional satisfaction and creating meaning are tied together, and I think allowing yourself to feel a sense of professional satisfaction even when there's so much work to do and when people aren't all set is worthwhile. So maybe practicing that. And when someone gives you a compliment, one of the first things I talk about with self-care with people I work with is if someone gives you a compliment, if I give someone a compliment, really a good answer would be thank you instead of, oh yeah, but you don't really understand it. It wasn't all that great. So work on being able to say thank you. As in a lot of areas of life, we're social beings. Remember the relatedness, psychological need? We need to be in relationships, including a healthy relationship with ourselves, which is what self-care is about. So encountering isolation, getting rid of isolation, or fighting isolation, individually you have a role and your work has a role. In terms of your personal life, if you're finding that important relationships are taking second stage to your work to the point where those relationships are being damaged, really look at that as a problem and take some time and do some organizing of priorities around that. Also, I find seeking community experiences in the general community where you work or live can be very rewarding because you get to see people who are like doing okay or worried well people or people who've had problems and overcome or some people who are not doing well. But you can get a wider swath of functioning levels that will give you a sense of perspective that sometimes can get lost when we dive into our work. In terms of spiritual life, the way I understand spiritual life is connecting in some way with a larger reality. That can be, for me, it's astronomy is a way that I feel very spiritual in terms of thinking about astronomy and participating in observational astronomy is a spiritual experience for me and very grounding. Now, in the professional life, in the professional sphere, I think all of these are key: supervision, training, professional development, overall organizational support, and being with people at some time who know exactly what you do. These are all, in my view, necessary. So, in terms of supervision, the supervision that I've found to be most helpful is to have senior people and junior people in a peer supervision group where there's no evaluation process going on. People can say uncomfortable things. What's in the room stays in the room, and it's seen as just part of what's necessary for doing the work, and it's done during work time on the company dime. It's not an add-on. It's not, oh, that's nice if you want to do it after hours. It's seen as part of the work. training. People need continuing professional education. People need continuing education and training irrespective of their position. There's always something that you can learn to do better. It doesn't matter your position or your level of experience. And that future orientation that comes with an investment in training is something that shows overall organizational support for the endeavor. In terms of development, on performance reviews, I think there should always be a mandatory section in there regarding the professional development of the individual. That goes right to issues pertaining to burnout, because you need a future orientation. How can this work out better? And bringing development into regular performance reviews is a way that an organization can show support for individuals. In terms of overall organizational support, it does help what the CEO says. It does help if the work that we do is valued by the organization. It does help that the little comments are made that our value to the community is appreciated. It might not take a lot for top management to say that, but it can be very helpful. The bottom bullet there of being with people at some time who know exactly what you do, I found going to conferences being the best way for me to get that. I have a few different niches of my professional life, and it's really only at those conferences where I find people throughout the country who do the same things that I do and can really understand the sort of problems and challenges that I face. Many of you might have been interested in mind-body approaches to self-care. I'm not an expert in that. Well, I've been trained in self-hypnosis. I use self-hypnosis techniques, but I don't consider myself an expert overall in terms of mind-body approaches to self-care. In the resources, there is a link to the Center for Mindfulness, and I would suggest going there as a source. Using these mind-body approaches can also open oneself up attitudinally to look at problems in a different way. So I'm going to be wrapping up here in just a couple minutes, but again, the workplace factors that I found to be most valuable is if the workplace understands that trauma-informed care is the goal of the organization, that supervision is necessary on company time, training is necessary, this is going to give the message that what we do is not a matter of more, just see more clients. It's a matter of also taking care of ourselves while we do the work. My last comments here would be, some of us get wounded. Some of us get wounded physically, but some of us get wounded psychologically. And some of us want to heal away from where we got wounded. If a client says, you know what, I'm going to do my work someplace else, or it's time for a change, being supportive of that person is the most important thing for their development. So if someone wants to stay and recover, or if someone wants to leave the field, leaving the field is not necessarily bad or wrong, and it may be that for a certain phase of someone's life, they're in the mode where they can give gladly and willingly to the work, and then they're ready for something else. So recognizing the privilege of working with people in need, which is what we do, understanding that the work we do does entail risks, and trying to protect ourselves as best as possible for our own well-being as well as the well-being of our clients. So that's what I have. I want to thank you all for showing up, and thank you to Victoria and also to Ben, who's been a great IT person behind the scenes there. So thank you, Ben Rock. And I'm going to hand the mic over to Victoria.
Thank you so much, Nick. We have several questions. I'm hoping we can get to all of these in our 10 minutes. The first one is from Betsy. I suffered immediate severe depression and sense of impending doom after the Newtown shootings. Wondering when one of my clients could turn and do something like that. Feels related to how we do work with people who we know have committed grave offenses. Can you elaborate on this?
Oh, yes. What I want to avoid is minimizing or ignoring the risks, because there are risks. And the fact that there are reality-based risks leads me to say things like, there are times when people just don't want to assume those risks. And that's not pathology, and that's not necessarily an irrational response. So that's what I want to say first, is that we should assume that our work does carry some elevation of risk over baseline. There's random risk just from living. We all know that. But then there are other factors that increase risk. And I don't want it ever viewed that it's a irrational or inappropriate response to say, you know what, I'm not okay with that level of risk right now. When we're confronted, which I was, because just personally, I heard about the shooting. I was actually in Newtown at the time of the shooting, and just coincidentally, it was just it took every wind out of my sails. It just brought me quite down for quite dramatically, and I didn't beat myself up for that either. I mean, this is horror, and so many different levels of horror in terms of what humans can do to humans, but also institutional poor responses in terms of how are we caring for our most vulnerable people. So it was a very depressing event, and I had a similar situation after 9/11 where people just felt that their defenses or their self-care was temporarily overwhelmed by the reality of what they had experienced. And then what I look for is how quickly do we bounce back? How quickly do we regain a sense of equilibrium and balance to deal with the pain and move forward? If that lingers, or if there's no bounce back, that becomes a source of real concern. And I normalize this, is that talking to someone who's a mental health professional should be the norm rather than an exceptional response. So I never hesitate to suggest that people should talk to their valued mental health provider on that issue. I'm open for a follow-up on that if the questioner feels that they want a follow-up question. That's really important.
Great. Thank you, Nick. Our next question is from Rosa. It's kind of similar. Is our burnout also signaled by dread of certain clients' tasks or situations?
I'd want to do the assessment of how reality-based the dread is. So if it's dread of one particular situation, which is a particular vulnerability for the person, for the care provider, I don't see that as necessarily burnout. I could see that as a situation where there needs to be additional supervision or maybe a workaround because of the vulnerability. Now, if the dread becomes generalized to a large percentage of the client contacts or a large percentage of the type of work tasks, then that is a burnout sign.
Great, thank you. Our next one is from Tarita. What suggestions do you have for HCH clinics who are experiencing high levels of fatigue, stress, and trauma exposure? I would think this one is especially relevant after Sandy and some of the problems they've had with clinics in the Northeast.
Thank you, and thank you for the context on that, Victoria. Sometimes our clinics get completely overwhelmed by a disaster or an overwhelming local event. I experienced it with Katrina, with one of the health centers down there that was just decimated by the hurricane, and we actually sent a team of mental health folks down there to try to work with the employees of the CHC to try to keep that group together so that they wouldn't just leave the area and that they'd feel supported in the critical work that they did after the disaster. So the caregiver in a setting where there's been a disaster or a major disruption is particularly vulnerable, and that's where I think institutionally, or maybe even at beyond the institution, a sort of organizational group like a NAC or a council or a primary care association might be able to help to bring in some outside resources to help shore up the caregivers as they respond to the community disaster or exceptional stress. We had it on a much lesser degree, much lighter scale. Up here we had an ice storm a couple of years back that was quite difficult, caused a lot of homelessness, and we were getting pretty fried pretty quick. I hope that answers.
Thank you, Nick. Our next question is from Susan. Do you know of any centers who have best practices in regards to holistic wellness? My HCH clinic is considering having organized yoga or fitness classes and would love great examples of places already doing this and how it's working.
You know what I would suggest for that, maybe? What do you think about a TA request on that? I don't have a best practice health center in mind, but I would be very interested in finding out. So maybe the council's TA group could address that.
I agree. Susan, if you'd like to contact us, we can ask around and get some information for you regarding that. You can email me. My email's on the staff page and also I think on the front of the webinar. So we'd love to chat with you more about that one. Our next question is from Elizabeth. What is the role of management to address the stressors of the job and develop a supportive work environment?
There it is. Okay. Well, I think management that's really what management does. I mean, management should be doing that. That's one of the joys of management, is to be able to work on developing the work environment to build a place where the good work can happen. That's sort of my idea of central to what management should be up to, because you need that safe workplace to provide the healing environment where your clients are going to be able to do the healing. And how the employees feel, they're being treated, how the employees feel about their safety and work environment gets passed right through. It changes the milieu. It changes and affects the healing environment. So management's job is to make a sustainable, and that does mean economic, but a sustainable healing environment. So I see it as central.
Thank you, Nick. We have some other questions, but we're just about out of time, so we'll follow up with those questions via email. We're sorry we couldn't get to them live on the webinar for you.
And I'd love to answer them. I will answer them by email.
Yes, thank you so much, Nick. So thank you all for joining the Self-Care Basics in the HCH Setting webinar. This has been produced by the National Healthcare for the Homeless Council. This webinar will be archived on our website at nhchc.org within 3 business days. Questions that presenters were unable to respond to will be addressed via email, per Nick right now. At the close of this webinar, you will receive a link to a survey evaluation. Please complete that so that we are able to improve your webinar experience. A link of the archived webinar will be emailed to you once it's posted to our website if you registered with your email address for the webinar. I'd also like you to take a look at our website. You can register for other council webinars there. You can listen to our Self-Care for Healthcare Providers podcast series. And you can also register for the 2013 National Healthcare for the Homeless Conference and Policy Symposium March 14th through the 16th in Washington, D.C. and take advantage of that opportunity to meet other people in your field. Thank you so much, and this meeting will now be closed.